for the university anthem.
Please be seated. The Acting Registrar and Secretary to Council, Mrs. Olakunle Makinde. The Bossa, Mrs. Oluwafumilola Adekunle. The University Librarian, Professor Yetunde Zaid. The Provost College of Medicine, Professor David Oke. The Dean, Faculty of Dental Sciences, Professor O.M. Botolom. Distinguished ladies and gentlemen, I warmly welcome you to the 26th inaugural lecture of the university in the 2023-2024 academic session, titled, Guard Your Mouth and Keep Yourself from Calamity, the role of the oral and maxillofacial pathologist, to be delivered by Professor Oluseyi Folake Ajayi of the Department of Oral and Maxillofacial Pathology, Biology Surgery, Faculty of Dental Sciences, College of Medicine, University of Lagos. Professor Oluseyi Folake Ajayi was born on April 11, 1959 in Lagos, Nigeria, to Mr. Daniel and Mrs. Abigail Ogunpola of Maku, Oshi, Ogun Waterside local government area in Ogun State. She holds a Bachelor of Dental Surgery degree obtained in 1985 from our College of Medicine. She had her postgraduate training at the Lagos University Teaching Hospital between 1987 and 1994 and became a fellow of the National Postgraduate College of Nigeria in the specialty of oral and maxillofacial pathology. On an exchange program that she went to at the Department of Oral Pathology, University of Newcastle upon Tyne, UK, she completed her studies as a senior registrar in 1994. In 2005 to 2006, she obtained the Master of Public Health degree and was also awarded the Fellowship of the West African College of Surgeons. Professor Ajayi began her career at the University of Lagos in 1995 as a lecturer grade 1. She rose to become senior lecturer in 2005, associate professor in 2011, and was appointed professor in 2020. She has spent the past 29 years training undergraduate dental, medical, and basic dental nursing students, Professor Ajayi, who is the current head of the Department of Oral and Maxillofacial Pathology and Biology, has also been actively involved in training new academic staff in teaching methodologies over the last 17 years. Outside of the university, the accomplished professional has served as examiner at the National Postgraduate Medical College of Nigeria, a member of the board faculty of dental surgery at the National Postgraduate Medical College, and external examiner to their other universities at various times. Professor Ajayi has served as the national treasurer of the Nigerian Dental Association, chairman of the Lagos branch of the Nigeria Dental Association, president of the Nigerian Association of Oral and Maxillofacial Pathology and Oral Medicine, a body which she actually initiated. An avid academic cum researcher, Professor Ajayi is the co-author of a popular oral pathology book, Fundamentals of Oral Maxillofacial Pathology and Medicine. Her area of interest is in salivary gland neoplasm, orofacial neoplasm, and childhood tumors. A devout Christian and a member of the Anglican Communion, Professor Ajayi is chairman of the board of Pentecost Medical Center, Festac Town, here in Lagos, patroness of the Anglican Communion Boys Brigade, Ijebu Diocese 6. She is happily married to Ashiwaju Tayo Ajayi and blessed with children and grandchildren. Distinguished ladies and gentlemen, I hereby invite Professor Oluseyi Folake Ajayi to deliver her inaugural lecture. The Vice Chancellor, the Deputy Vice Chancellor Academic Development Services, the Deputy Vice Chancellor Management Services, the Deputy Vice Chancellor Academic and Research, the Acting Registrar, the Bursar, the Librarian, the Provost College of Medicine, the Dean Faculty of Dental Sciences, Deans of other faculties here present, members of the University Senate, heads of departments, distinguished academic and professional colleagues, distinguished non-teaching colleagues, administrative and technical, your lordship, spiritual and temporal, dear students, past and present, gentlemen of the press, print and electronic media, distinguished guests, ladies and gentlemen, I welcome you all to my inaugural lecture titled, Guard Your Mouth and Keep Yourself from Calamity, the Role of a Maxillofacial Pathologist. Madam Vice Chancellor, I am immensely grateful to you for the approval given to me to stand before this audience today to deliver my inaugural lecture. As a professor of oral and maxillofacial pathology at the University of Lagos, University of First Choice and the nation's pride. This is the 26th in the 2023-2024 academic session. And I thank God Almighty for making this day a reality. Today's inaugural lecture is the second in the history of the Department of Oral and Maxillofacial Pathology / Biology, and is being delivered by the first female oral and maxillofacial pathologist in Nigeria. This inaugural lecture provides an opportunity to introduce my field of expertise and share my academic and professional achievements with members of the university community, colleagues, family, friends, students, and the general public. Growing up, my dad wanted me to be a lawyer and a diplomat. I like the idea of being a diplomat because I love traveling, but not a lawyer. My mom was a nurse, a very compassionate one too, and I saw the way she helped people, and I wanted to be a nurse like her. When I grew up, this idea changed
when I was at a station at Randall Health Center, Surulere. There I saw a young doctor who just resumed, treated. Like, story short, I ended up in dentistry. I was inspired to pursue oral and maxillofacial pathology for my postgraduate training because of the way Professor Hezekiah Adeyemi Mosadomi, he's seated right there in front. The way he used to deliver his lecture to my class without any notes, right away, and I was in awe and decided I wanted to be like him. The popular Bible of Oral Pathology, a textbook of oral pathology by Schaefer, Hein, and Levy, became a novel for me, and I started reading it the way I used to read Nails and Bone. I am grateful to late Professor Shogasho Folake, may his soul rest in perfect peace, who met me on the corridor one day and asked me, Dr. Ajayi, when will you finish your residency training and join the college? The job is waiting for you. I looked at him with surprise, and I quickly answered, soon, sir, very soon. Thus, the idea of going into academia was born, and I joined the Department of Oral Pathology and Biology in 1995 as Lecturer 1. At first, there were 3 academic staff in the department. Professor Tolu Dukoya, I think it's somewhere in the crowd. Yes, somewhere down there. Professor Tolu Dukoya, Dr. Iyo Taiwo, and myself. Professor Dukoya soon proceeded on assignment, and Dr. Taiwo went on sabbatical leave. Dr. Taiwo came back and resigned immediately, leaving only yours truly in the department. And I found myself alone at the helm of affairs of both departments in the college and the Lagos University Teaching Hospital, performing academic and clinical duties. The responsibility of teaching 2 courses and 4 levels of students, that is 300, 400, 500, and 600 levels, was placed solely on my shoulders. At the same time, I had to take care of my family. It got to a point. My husband looked at me and said, you will not make me a widower. He then bought tickets and sent the children and I away on holiday. Thank God he's alive today to witness his wife, the professor of oral and maxillofacial pathology, deliver this inaugural lecture. For unknown reasons, many people think dentistry is only a department. Actually, there are 10 specialties with subspecialties in 5 departments. Just now, it was read that the department is oral and maxillofacial pathology / biology surgery. There is no surgery in ours. Ours is oral and maxillofacial pathology / biology. Oral and maxillofacial pathology is one of the specialties in dentistry. And this specialty is, however, different from oral and maxillofacial surgery, which is often confused with it. And this is involved with the surgical management of diseases of the maxillofacial region, while the oral and maxillofacial pathologist provides the histologic diagnosis. The oral maxillofacial surgeons require the input of the maxillofacial pathologist in making appropriate decisions on the treatment plan for the patient. We work together. What is the scope of maxillofacial, the scope of the maxillofacial region? If you look at the picture there, the maxillofacial region extends from the hairline above, that is from your hairline, right down to the hyoid bone in the neck. And it extends posteriorly to the back of your neck, of the ramus, that is behind your ears, the bone behind your ears. And that is the extent. It also includes the jaws there, and that's the maxilla and the mandible, and then you also have the temporomandibular joint, which helps you to open and close your mouth. Then you have the mouth itself, that is all the structures in the mouth, and then you have the salivary glands. The salivary glands, you have 2 on either side, 2 in front of the ears, 2 below the jaws, and at the back, and 2 in front in the floor of the mouth, as you can see in that picture there. Now, it also includes the perioral region skin, that is the skin around the mouth. And this is a component of the oral maxillofacial region. Now, the specialty deals with the causes, processes, and the nature and identification and management of diseases affecting the oral and maxillofacial region. The title of today's lecture, Guard Your Mouth and Keep Yourself from Calamity, is called from Proverbs 21:23, which says, those who guard their mouth and their tongue keep themselves from calamity. The title is a spiritual injunction, but in the course of this lecture, we are going to apply it as it affects our oral cavity or our oral health. Madam Vice Chancellor, why do we need to guard our mouth? I'll be discussing the why, when, and how to guard your mouth, and the role of the oral and maxillofacial pathologist in all this. I will also take you through some of my research contributions to knowledge. Madam Vice Chancellor, what are we guarding against? Several diseases can afflict the maxillofacial region, and these can lead to calamity if not prevented or attended to on time. These diseases can involve the soft tissue or the bony regions. They are of diverse and varying causative and risk factors, having sundry presentations, assorted outcomes, dissimilar diagnostic features. And these diseases can be developmental, autoimmune, infective, metabolic, traumatic, neurologic, and neoplastic. The neoplastic diseases may be life-threatening and can cause disfigurement or impair basic functions as talking, swallowing, and breathing. You can see the picture there. The lesion there is so huge, causing disfigurement, and this one can affect your speech and your eating and all the other functions. Life-threatening or not, your mouth should be guarded. Orofacial neoplasms can be broadly classified into odontogenic and non-odontogenic tumors. The non-odontogenic tumors arise from remnants of tooth-forming structures, those structures that form the teeth, and they are unique only to the oral cavity. You will not find them anywhere else. Non-odontogenic tumors arise from other tissues, such as the blood vessels, lining of the mouth, lining of the sinuses, salivary glands, nerves, muscles, and lymph nodes. To a layman, all orofacial tumors are known as oral cancers. In quotes, oral cancers, however, can arise from other tissues, and those arising from the lining of the oral cavity, the sinuses, perioral skin, salivary glands, and some arising from parts of tooth-forming structures are referred to as oral cancers. These are the real oral cancers. While those arising from blood vessels, bone, soft tissue, muscles, blood, and other tissues are referred to as sarcomas. Those arising from lymph nodes are called lymphomas. Oral cancers can be benign, which means non-cancerous, or cancerous, that is, they are malignant, that we use the word malignant. Non-cancerous tumors are slow-growing and do not invade other tissues, while the cancerous ones grow at a very fast rate and invade the surrounding tissues. They can move to distant sites. The non-cancerous lesions do not kill, but can result in disfigurement of the jaws, while the cancerous ones can result in death if not attended to on time. I will be concentrating my lecture this evening on orofacial cancers because they are the most destructive and can result in calamity if one is afflicted, and I will give the simplest definition of oral cancers. Oral cancer can be defined as an abnormal mass of tissue that forms as a result of failure to respond to normal cellular regulatory mechanisms they divide more than they should, and the cells will not die when they should, resulting in swellings. We will be discussing or focusing on oral cancers this evening, and those are the ones that arise from the oral and sinus mucosa, that is the lining, those around the perioral skin, the salivary glands, and the odontogenic epithelium. Oral cancer is a growing health problem that is common in several regions of the world. They constitute the main life-threatening diseases apart from maxillofacial trauma, and they may be encountered in dental practice. Global occurrence shows that head and neck cancers constitute between 5 and 50% of all cancers, and the orofacial region has been reported to be a common site. In most parts of Europe and America, oral cancers account for 2 to 4% of all cancers. The white areas there, this is Europe, and the white area here shows all the white areas are oral cancer, areas affected by oral cancer, less than 4%. But in Sri Lanka and India, India is there. The blue area in the middle there, below that white area, is Sri Lanka. And that area shows more than up to 40% of occurrence of oral cancer. The World Health Organization reported a low incidence of oral cancer in Africa. If you look at the chart, Africa is the last on the list here, and India is somewhere up here. This is because there have been few reports published on cancerous lesions of the orofacial region in the African environment, and with fewer reports still from Nigeria. This informed our review of cases of primary malignant orofacial neoplasm seen at the Lagos University Teaching Hospital. Madam Vice Chancellor. In our study, we observed that malignant, that is the non-cancerous tumors, constituted 18% of all the biopsies of orofacial lesions seen within the period of study. And the oral cancer constituted 69% of the malignant tumors seen. This suggests that oral cancers are not as uncommon as we think, so we need to guard our mouth. Oral cancer in children. Oral carcinoma is an age-related disease, and only about 3 to 5% of head and neck tumors occur in children. Ajayi et al. 2007, in the study to determine the relative frequency of orofacial cancerous neoplasms in children and adolescents, observed that cancerous neoplasm constituted 13.3% of orofacial tumors and tumor-like lesions, and exclusively affected patients in the second decade of life. That is the age between 10 and 19 years. Madam Vice Chancellor, even in children, oral cancers are not that uncommon. Therefore, adult or child, we need to guard our mouth. Oral cancer in salivary glands. Even though salivary gland lesions are relatively uncommon in general populace, they account for a huge number of oral pathologic biopsies. These lesions are either neoplastic, inflammatory, immunopathologic, or cystic. Madam Vice Chancellor, in our study of salivary gland lesions in Lagos, we observed that cancerous salivary gland tumors were more prevalent than non-cancerous tumors. Carcinomas of the salivary gland can present as either a swelling or an ulcer in front of the ear. That's a swelling in front of the ears, or an ulcer below the ear, below the jaws. And these lesions you can also find in the floor of the mouth. Madam Vice Chancellor, in another study, we found that most of the submandibular salivary gland pathologies that necessitated surgical removal in our institution were cancerous. And this is another reason, ladies and gentlemen, why we should guard our mouth. How do oral cancers present? Oral cancers may present as inconspicuously as red or white lesion. You can see a red lesion on the tongue there, or a white patch on the lip, or a mixture of red and white patch, or simply as nodules, as you can see on that, in that picture, or ulcers. As you can see, there is a caseating ulcer in the, on the palate there, and there's another ulcer on the tongue here. And the ulcer may resemble a traumatic ulcer. That is ulcer due to trauma. But note, if an ulcer does not heal within 2 weeks, please visit your dentist. It is suspicious. Other lesions may present as swellings, like you can see in the last picture there, or lumps or masses in the mouth. The patients may present in the clinic with loosening of the teeth or bleeding or discharge. There may be pain or numbness or tingling sensation in the face, jaw, or mouth. Lymph nodes in the neck or jaws may be enlarged. There may be foul odor from the mouth or nose, and there may be difficulty in swallowing or speaking, and there may be hoarseness of the voice. Now, if your voice becomes hoarse and it persists, you need to do something about it. There may be facial deformity, weight loss due to tumor growth. When the tumor affects the sinuses, it presents as stuffy nose or chronic sinusitis. It is essential to consult a dentist if any of these symptoms persist or worsens over time, as early detection and treatment significantly impacts treatment outcomes and prevent calamities. How do we arrive at the diagnosis? The maxillofacial pathologist makes the final diagnosis upon which treatment decisions are made. This requires a thorough medical, dental, and social history, assessing certain lifestyle risk factors, including family history. Intraoral and extraoral examination, screening tests such as blood tests, imaging such as radiographs, CT scan, MRI, ultrasonography, and so on. The responsibility of making a definitive diagnosis is placed on the maxillofacial pathologist, who utilizes biopsy and histopathologic technique with the aid of the microscope. What is a biopsy? A biopsy is a surgical procedure that involves the removal of a piece of tissue sample from the tumor or lesion for examination under the microscope. And types of biopsies we use include excisional biopsy, incisional biopsy, exfoliative cytology, fine needle aspiration biopsy, and punch biopsy. Histopathologic technique involves the biopsy tissue being fixed using a fixative, then processed, placed on a glass slide like this. That's a glass slide, and the tissue is that small, tiny pink thing in the middle of the glass slide. It is stained with hematoxylin and eosine dye to enhance the visibility of the cellular structures, and then the slide is viewed under the microscope, as you can see me doing there, viewing it under the microscope, and it is reported and sent to the surgeons to plan treatment. The oral and maxillofacial pathologists play a crucial role in determining conclusively the type of tumor being assessed, and by doing so, predict how a disease may progress. Sometimes, a lesion might appear non-cancerous clinically, but when viewed under the microscope, it is actually cancerous. Taken as an example, adenomyocystic carcinoma, which is the most common salivary gland carcinoma in Nigeria, Ajayi et al. 2017. It is a slow-growing tumor that clinically mimics a non-cancerous tumor, but histologically is aggressive and cancerous. The tumor has been shown to display 3 histologic patterns, namely the cribriform, the solid, and tubular patterns. The histologic pattern presents variable aggression. Now, the solid histologic pattern is said to have the worst outcome or worst prognosis. When the maxillofacial pathologist provides this information to the surgeon, he can determine the type, extent of treatment, and the treatment outcomes. We investigated the association of histologic variants of adenocystic carcinoma with its clinical aggression in cases from Nigeria using established criteria with slight modification. Clinical aggression was speculated based on the estimated growth rate for each tumor. Madam Vice Chancellor, we observed that the most common histologic pattern is the predominantly cribriform, low solid pattern. And in both major and minor glands, there was association between the histologic pattern and the estimated growth rate, respectively. However, we found out that the trend of clinical aggression of histologic pattern based on the estimated growth rate varies depending on the type of salivary gland tumor, whether the gland affected, whether it is the major or minor. The maxillofacial pathologist not only makes diagnosis based on the histologic pattern, but also the histologic grade and the stage of the tumor. The grading system is important for determining treatment and treatment outcome. For example, in oral squamous cell carcinoma, a diagnosis of carcinoma in situ, that is cancer occurring within the epithelial layer, that's the surface layer. The tissue below, beneath it, is not affected. It has not invaded the tissue beneath it. In this case, it has a very good outcome. You can achieve total cure because it's still at the early stage. While the well-differentiated tumor, where the cancerous tumor still resembles the normal tissue, but it has invaded the tissue beneath it, has a better treatment outcome than the poorly differentiated that has invaded the tissue beneath but does not resemble the normal tissue structure anymore. Madam Vice Chancellor, in our study, we found the poorly differentiated squamous cell carcinoma was the most common type, followed by well-differentiated and moderately differentiated subtypes, respectively. Sometimes there is an initial difficulty in histopathologic diagnosis using the hematoxylin and eosin stain. The oral and maxillofacial pathologist may have to resort to other techniques like immunohistochemistry and/or molecular studies. Immunohistochemistry uses special markers which help the pathologist to be sure that a tumor is actually a cancer and not something else. Immunohistochemistry uses special markers, and it also predicts the outcome and how well someone will do after treatment. Molecular studies go deeper and detect chromosomal changes, that is mutations and losses in the cancer. Both are important because they help to plan the best course of action. Some lesions share similar microscopic features, and to prevent wrong diagnosis in such cases and to avoid wrong treatment, immunohistochemistry may be required. Ajayi et al. 2018 reported a case which emphasized the need for immunohistochemistry in confirmatory diagnosis of salivary duct carcinoma. Salivary duct carcinoma is a tumor that resembles intraductal breast carcinoma. This is important because breast carcinoma may spread or metastasize to the jaws, while the salivary duct carcinoma may spread to the breasts, making it crucial to confirm the diagnosis. Madam Vice Chancellor, how can we guard our mouth and keep ourselves from calamity? There is a wide variation in occurrence of oral cancers across the world, and this can be partly explained by the differences in the prevalence of major risk factors in different geographic areas and also between genders. The cause of most orofacial tumors remains obscure. The cause of oral cancer is multifactorial. Genetic predisposition has been suggested, and environmental predisposing factors such as viral infection, smoked food, very hot foods, spicy foods, dietary deficiencies, trauma, alcohol use, tobacco use, better not chewing, that is done mostly in India, chronic irritation, poor oral hygiene, mold-infected groundnut, which will produce aflatoxin, the carcinogen, crack cocaine, and industrial pollution have been implicated. However, several steps can be taken to protect one's mouth and reduce the risk of developing oral cancer. A change in lifestyle and an avoidance of environmental predisposing factors such as tobacco use, alcohol use are advocated. Maintenance of good oral hygiene, regular dental checks, and a healthy diet are also advised. Vaccination against human papilloma virus and protection from ultraviolet radiation will help to prevent development of oral cancer. It is important to know your family history and be vigilant. Some tumors are known to occur in families. By following these preventive measures, one can significantly reduce the risk of developing oral cancer and the calamities that may follow. Remember, prevention is better than cure. Early detection. There are certain conditions which can precede the development of oral cancers, known as precancerous lesions. They can present as white lesions. These are lesions that cannot be rubbed off. As you can see here, there are white lesions beneath the tongue here, and then you have another one here on the lateral border of the tongue. They are called leukoplakia. Then you have the red lesion, as I showed you earlier. They are called erythroplakia. Then hyperplastic candidiasis, which is caused by candida infection. Then you have smoker's palate or nicotinic keratosis as a result of smoking, either smoking cigarettes, smoking cigar, or reverse smoking. Some people use the burning end and put it in their mouth to smoke, and so that will cause nicotinic keratosis. Then you have lichen planus, white sponge nevus, and oral submucous fibrosis. These are all precancerous lesions. Regular self-examination in front of the mirror and dental checks can help detect these lesions and even oral cancer early when it is more treatable. Together with my collaborators, we carried out a study into the pattern of precancerous oral lesions in a selected population in Nigeria. This was to investigate the prevalence and distribution of precancerous lesions to obtain pilot data useful in planning oral health care in Nigeria. Our findings: we found out that more women attended the clinic during the period of study than men. There was a prevalence of 0.9% of oral precancerous lesions in the population screened, and these occurred more frequently in men over 40 years of age. Men, please take care of yourselves. The hard palate was the most frequently involved site. More than 25% of the precancerous lesions have the tendency to undergo malignant transformation. From these results, it is suggested that mass screening should be focused on persons over 40 years of age. Please visit your dentist regularly to avoid calamity. Early diagnosis of precancerous and cancerous lesions is an important factor in avoiding the calamity of orofacial cancers. Awareness campaign and mass screening are important factors in early detection. Because when people are aware, then they will they will be on the lookout. Mass screening can be done using the following methods. Toluidine blue, a simple, inexpensive, and sensitive chairside test, which can be used for mass screening, and it is also useful in a resource-limited environment like ours. Chemilucent Visalite, developed by a Nigerian, one of our own that finished from this university. A chemilucent method that uses light, followed by toluidine blue application. Veloscope can be used, oral CDS can also be used. Early presentation is of the essence in the management of orofacial tumors to avoid the possible calamities that might arise as a result of delayed treatment. Quite often, patients present late to the clinic either out of lack of awareness, fear of surgery, or because of the cost of treatment. Calamities that may result from late presentation include facial disfigurement, and this will impact daily life, relationships, self-esteem, and overall quality of life. Functional impairment, as we have said earlier, and that will affect eating, swallowing, breathing, and overall well-being of the patient. Pain, suffering, discomfort, and emotional distress. Emotional trauma can lead to anxiety, depression, and post-traumatic stress disorder. It can also lead to treatment complications. Recurrence, that means it will recur because you may not be able to manage it properly. Financial burden, high risk of death, which is the last resort, the last thing that can happen when there's delay in presentation. Late presentation reduces treatment effectiveness, increases calamity severity. Avoidance of quacks. Many of us in this country will rather go to quacks first before visiting the dentist. It is advised to seek treatment from qualified professionals. Visit your dentist to avoid calamity. The lack of awareness, financial constraints, and ignorance often drive people to visit quacks and non-professionals. Once the patient presents in the clinic, treatment options include tumor removal, that is surgery, radiation therapy, chemotherapy, and more recently, we use drugs, targeted drug therapy. In all this, early detection, early presentation still gives the best outcome. So, guard your mouth and keep yourself from calamity. Other contributions to knowledge. I have supervised 10 postgraduate dissertations, and to God be the glory. One of them is a professor today and is the current dean of the Faculty of Dental Sciences, University of Port Harcourt. I was appointed as one of the pioneer coordinators of the Medical Education Development Unit, MEDU, of the College of Medicine. The MEDU helped to revise and redesign the old medical dental curriculum of the college into the new student-centered SPICES curriculum, of which the second set is currently in the final year. I'm chairman of Dental Education Committee of the Faculty of Dental Sciences from 2014 to date. I co-authored a chapter on fibrosous lesions of the jaw in the book Fundamentals of Oral Pathology. I have been a reviewer for some learned journals. I have been a resource person in numerous training of trainers, training the junior colleagues as they come in. This is sponsored by MEPIN and BRAINS. Madam Vice Chancellor, I thank you for giving me that opportunity During my sabbatical leave to Kano, I carried the gospel of the case-based learning method to Faculty of Dentistry, Bayero University, Kano, where it was embraced. I served as coordinator of the department for 6 consecutive years, acting head for 8 terms, and became professor and head 2023 to date. I was course advisor, sub-dean, member of the board of Medical Consults, elected member of Senate representative on the scholarship and loan scheme, Senate member currently, academic board, member of the academic board CMUL, and I have served on several other committees. During the period of my headship in the college, I was also the head of department at the University of Lagos University Teaching Hospital. I've been a member of the School of Basic Dental Nursing, and I've chaired several disciplinary panels for youth. I was a visiting lecturer at the Faculty of Dental Surgery, University of Port Harcourt, visiting lecturer at the Faculty of Dental Surgery, Kwame Nkrumah University of Science and Technology, Kumasi, Ghana, and to the glory of God, 5 of the students I've mentored are currently undergoing postgraduate training in oral pathology in various countries. I was a visiting lecturer at the Faculty of Dentistry, Bayero University, Kano, again to the glory of God. One of the students is currently in my department and another in Aminu Kano Teaching Hospital for the postgraduate training in oral maxillofacial pathology. I'm a founding member of the Association of Oral and Maxillofacial Pathology and Oral Medicine, and the first vice president. And later, I became the first female president of the association. The African Journal of Oral and Maxillofacial Pathology and Oral Medicine was launched during my tenure as the first female president under the distinguished chairmanship of our very own lady of many firsts, Professor Folake Ajayi, then Provost, College of Medicine. Conclusion, Madam Vice Chancellor. During the time allotted for this presentation, I have discussed the various calamities that can significantly impact an individual's quality of life, self-esteem, and overall health. Exploring the role of the oral and maxillofacial pathologist, emphasizing the importance of preventive care, early detection, and timely treatment in oral health. I have been able to discuss some of my scientific research findings, draw on my experience in teaching, oral and maxillofacial pathology practices, and research, and other services I have contributed to in my area of specialty. Recommendation. I recommend regular self-examination for lumps or color changes in the mouth and regular visits to the dentist every 6 months. Lifestyle changes to avoid risk factors such as tobacco use, alcohol use, and consumption of high-risk diets. I recommend oral health awareness and mass oral screening focused on persons over 40 years of age. I also recommend inclusion of subsidized treatment for oral cancer in the National Health Insurance Scheme. Madam Vice Chancellor, I recommend merging of oral and maxillofacial pathology, oral medicine, and oral radiology to form the Department of Diagnostic Sciences and conform with what is obtained across other faculties in Nigeria and across West Africa. First, acknowledgement. First, I acknowledge God Almighty, without whom I would not be standing here today. I give him thanks and praise. He knew me, shepherded me, and guided me to this day. Without him, there is no me. To him be all glory, honor, and praise for keeping me in good health and making me who I am. Madam Vice Chancellor, you've been a great sister, friend, encourager, and supporter. I pray that God will not leave or forsake you. He will continue to give you wisdom and grant you favor and grace in Jesus' name. Thank you.
I acknowledge and thank our amiable Deputy Vice Chancellor and all the principal officers of this great university, University of First Choice and the nation's pride. Professor Familon, immediate past Deputy Vice Chancellor, Academic and Research, and Professor Ben Ogojiefo, immediate past Deputy Vice Chancellor, Administration, thank you for your support and encouragement. I appreciate the Provost College of Medicine, Professor Walioki, and his management team, past provosts and their management teams. Every single one of you have impacted my life, and my success story cannot be complete without you. I thank the Chief Medical Director, Professor W.L. Ajayi and his management team, all past CMDs, thank you very much. I thank the current Dean, Professor Botolong, all past Deans, you all allowed God to use you for my success story. God bless you mightily. All my teachers from Methodist Primary School, Surulere, through Methodist Girls High School, Yaba, and College of Medicine, thank you all for giving me a solid foundation in life. Special thanks to Professor and Mrs. Adeyemi Mosadomi for the encouragement. They chaired our wedding reception too. Professor Mike Isikwe, who facilitated my going to the University of Newcastle upon Tyne, United Kingdom. Professor Tolu Odukoya, my teacher and mentor. And Professor Sanija Boga, who taught me administration. I'm grateful to all of you. Thank you. To all my collaborators, I thank you all. Time and space will not permit me to mention every name, but I must single out Professor Lado India and his twin sister, Professor from another mother, Professor Ogulewe, and Professor Watu Laoyadeyemo. You are the greatest and the best. Thank you. Special thanks to Professor Ogulewe, Professor Folake Ajayi, Professor Roti Da Costa, and Professor Shanu and Professor Sheyebi for their advice during the preparation of this lecture. Thank you very much. Professor Dechina, Professor Francis Adu-Ababio, Professor Adebola, I thank you all. Professor Nicola, my mentee, who is now a professor, you are all appreciated. Colleagues at the National Postgraduate College, former Registrar, Medical and Dental Council of Nigeria, Dr. Sanusi, Association of Oral and Maxillofacial Pathologists, African Group and Nigerian Group, MD Can Youth, Medilab 85 Sec, BDS 85 Alumni, all God Methodist Girls High School family, ably led by Major General Tilewa Amosu. I appreciate you all. To all my colleagues in the faculty, thank you. All youth and CMUL staff, thank you. All dental students, thank you. I must mention Subdean Emeritus, Professor Smolarity, thank you. I thank my colleagues in the department, Professor Olajumoke Efiam, Professor Ogundana, and Dr. Ogundana and Dr. Abdulwahid Akinshipo, who is leading the planning committee. Thank you very much. Oba Barrister Segun Ogunye, I thank you. Kabiyesi. Oba Kazeem Salami Oshobi of Mako, thank you, sir. Kabiyesi. Thank you for honoring me. All officers here present, I appreciate you all. I acknowledge the Vicar Parish Council and members of the Church of Pentecost Anglican Communion Festac Town. I am single out the Christian Ladies Friendly Society, the Vicar and Parish Council, St. Andrew's Anglican Church Mapomi, all my friends and well-wishers. Time and will not permit me to name you one by one. Those online, thank you very much for your time. To the Ajayis, I thank you for accepting me to your family as one of you. Your show of love, support, and cooperation has been amazing. God bless you all. The Allah means fanatism. I thank you for giving me a son and accepting my daughter as yours. The bond of love between us shall never be broken in Jesus' name. To my paternal family, the Ogupolus of Makomi, Ogunwatisai local government, my maternal family, the Awukaras of Efire, my wonderful siblings, Yemi, Bukola, Durotola, Olaitan, Kemi, and their spouses, my late brother, Mr. Kende Bukoli, and my late sisters, Mrs. Toyi Fajobi and Mrs. Olabisi Leke Adenega, may you continue to rest in peace. All my nephews, nieces, and cousins, you are all great. Thank you all for your love. My late parents, Mr. Daniel Ogunpolu, and my mom, Mrs. Abigail Ogunpolu, they laid a very solid foundation upon which blocks have been placed to produce the inaugural lecturer of today. I'm eternally grateful. If you can hear me wherever you are, I say the biggest thank you. Fruits of my womb, Ololade, Oladimeji, and Abisola, they shocked me and surprised me with their presence. Thank you very much. And my beloved son, Olamide Olakomi, I thank you. God bless me with many children. Kayode, Dayo, Deji, Tosin, I'm grateful to God for the stability, peace of mind, and unity we all have shared. Thank you. I'm proud of you all. And my grandchildren, you can see our baby, Oladide the third. I just want to say I love you all. Ibukubalale, God bless you. Finally, I especially wish to thank my husband, T.T., my love, my friend, my prayer partner, Ọ̀túnba Aṣíwájú Ọbaruwa Táyọ̀ Thomas Ajayi Olóyè Púpọ̀. A very honorable gentleman and a worthy alumnus of the university. Thank you for setting high standards for the children to follow. Thank you for being there for all of us. Thank you for being my editor and joining me in the preparation for this lecture. God bless you and renew your strength. Madam Vice Chancellor, I have come to the end of my lecture. Distinguished ladies and gentlemen, I appreciate you all for honoring my invitation to this inaugural lecture. Please remember, those who guard their mouth and tongue keep themselves from calamity. Visit your dentist regularly. I thank you all for your time and attention. Thank you.
It's okay now. Leave the place. This one is a monopoly. It's a monopoly. No. It's a monopoly.
Please be seated. We have in our midst today some of the former principal officers of our university. With us is Professor Oluwole Familoni, former Deputy Vice Chancellor, Academics and Research. We have Oluwarotimi Shodimo Esquire, former Registrar of the university. Also with us is Professor Onotolu Odukoya, the former Chief Medical Director, Lagos University Teaching Hospital. And we have Professor Wasiu Adeyemo, the current Chief Medical Director, Lagos University Teaching Hospital.
We also warmly welcome Professor Akin Oshibogun and Professor Tolu Odukoya again in their capacities as teacher and mentor of the inaugural lecturer. We recognize the presence of Professor Adeniyi Oshutogun, OFR, the former Vice Chancellor of Obafemi Awolowo University, and his wife. His Royal Majesty, Oba Kazeem Adeshina Salami Ilufemiloja the One, Oshobia of Makun Omi, Ogun Waterside, LGA, Ogun State, Kabiesio, and your distinguished chiefs that have accompanied you. We recognize you. Engineer and Mrs. A.O. Odunsowo and other members of the Pentecost Anglican Communion, Festac Town, the Old Students Association of Methodist Girls High School, Archbishop John Osaoni, the Vice President of the Pentecostal Fellowship of Nigeria, we acknowledge you. Members of the Medical and Dental Council of Nigeria and the Association of Oral and Maxillofacial Pathologists, we acknowledge you. We recognize also the entire members of the Ogunpolu and the Ajayi families. We specially acknowledge Ololade, Oladimeji, and Abisola, the children of the inaugural lecturer. And of course, we doff our cap to Ashiwaju Obaruwa, and with permission, the special TT, Tayo Ajayi, the spouse of the inaugural lecturer. The registrar and Secretary to Council, Mrs. Olakunle Makinde. The bossa, Mrs. Oluwafunmilola Adekunle. The University Librarian, Professor Yetunde Zaid. The Provost, College of Medicine, Professor David Oke. The Dean, Faculty of Dental Sciences, Professor O.M. Botolom. Distinguished ladies and gentlemen. Professor Oluseyi Folake Ajayi has just delivered the 26th inaugural lecture of this university in the 2023-2024 academic session, titled, Guard Your Mouth and Keep Yourself from Calamity, the role of the oral and maxillofacial pathologist. Professor Ajayi has taken the pains through this inaugural lecture to introduce us to that field of the medical profession that is known as oral and maxillofacial pathology, explaining to us in depth the scope and the extent of the specialty. She interrogated what seems to be the low prevalence level of the various cancerous diseases that can afflict the maxillofacial region, especially in our own part of the world. But she argues that it is more likely because there is a paucity of knowledge than that there is a low prevalence rate in fact. Given that this is a new field, the inaugural lecturer has taken us through the various aspects of maxillofacial cancers, some of the causative factors, predictive factors, and has taken the pains to explain to us gone to great lengths to explain to us the role of the oral and maxillofacial pathologist in making accurate diagnoses, identifying risk factors, predicting patient outcomes, and contributing to research. She has also told us how it is important that we recognize the various factors that are implicated. She has
told us to be aware and be cautious of genetic dispositions, environmental factors, as well as the place of poor oral hygiene. She has used the opportunity of our inaugural lecture to emphasize the importance of maintaining good oral health in order to prevent the serious outcomes that can attend pathologies in the maxillofacial region. She has emphasized the place of early detection, timely treatment, because failure to do so can be significant and result in huge calamities. Hence the warning, keep yourself from calamity by guarding your mouth. Professor Oluseyi Folake Ajayi, now that you have successfully paid your academic debt to the University of Lagos, with today's very enlightening inaugural lecture, I have the honor on behalf of Senate to declare you discharged and acquitted. I therefore welcome you to the committee of professors that have paid their dues. Congratulations. I thank you all for coming and wish you safe return to your various destinations. I hereby declare this assembly closed.